One of the very common conditions we see are bunions. We also see hammertoes as well, and they're often related. Typically, these are due to structural and mechanical problems with the foot that cause abnormal forces on the toes. So what happens with a typical bunion is the big toe gets pulled over toward the second toe, pushing this first metatarsal bone out to the side. Then you have this prominent bone that protrudes and it rubs in shoes and can be very painful. And that's what we typically think of as a bunion. You can also develop what's called a tailor's bunion, where it's a small bunion or bunionette on the outside part of the foot as well, with similar mechanical problems leading to it. So this is sort of the typical bunion that you'll see. Now, conservatively, there's plenty of things we can do to help treat the bunions, ease the pain, and try to prevent it from getting worse to avoid doing surgery in the future if possible. So one of the first things we want to do is control the mechanics of the feet. And that could be with arch supports, custom arch supports called orthotics, and oftentimes an adjustment in the shoe gear. You don't necessarily have to wear orthopedic shoes, but you want to wear something that is supportive, has a wide toe box, maybe a soft, stretchable upper material that will stretch over that bunion deformity. We often use spacer pads placed between the first and second toe. That brings the toe over away from the second toe and reduces any irritation on the two toes. But also in straightening the big toe, sometimes the bone here will move in a little bit, and that little bit of motion can reduce the irritation in shoes. Topically, we can use analgesics like aspirin cream or capsaicin cream, which is beneficial if a nerve is getting pinched in that area and sending shooting pains into the toe. In severe cases where someone has an inflammation of the joint, or even a bursitis, which is an inflammation in a little pouch of tissue on the outside of that bone, and sometimes cortisone injections will help with that. Some people take anti-inflammatories for the discomfort as well. We have various types of pads that loop over the toe and basically create a little aperture to keep the pressure off of that bump, and that can be very helpful at reducing the pain. If we've tried all the conservative things and everything has failed, you still have the painful bunion, then there are some surgical options available. You'll see that for a very mild bunion where there's basically just a bump and the toe is not out of position, is simply remove that bump of bone, free up some of the soft tissues as well. In more of a moderate bunion, which is the most that we see, we'll remove the bump and generally cut through the head of the bone of this first metatarsal and move the bone over into place. You see these two little small bones here? They're called sesamoid bones. They're underneath this bone. They are actually tethered to the second metatarsal bone with ligaments. They don't move, but this metatarsal here dislocates away from them. So in order to correct a bunion properly, we need to move that metatarsal head back over those little bones, creating a more supportive joint, a more stable joint, in addition to freeing up the tight soft tissues here and straightening out the toe. So this would be your end result in that case, where the metatarsal head is cut, moved over. Now you see those two little bones are back into a normal position and the toe is straight. If the bunion is more severe, and we have a larger angle of this bone really far out to the side, then cutting the head won't be able to shift the bone over far enough. So we have to do a procedure back in the base of the bone. Here's one option where we remove a little wedge of bone, creating a longer lever arm because it's at the base, and swinging that bone over farther to make that correction, in addition to taking off the bump, freeing up the soft tissues to straighten the big toe. In some cases, if there's a great deal of mobility, there is too much motion at this joint here, this is called the metatarsal cuneiform joint, we actually do a procedure whereby we remove a wedge of bone, but actually fuse that joint too, to create more stability to prevent the bunions from coming back. After any type of bunion surgery, and most of this can be performed as an outpatient procedure, same-day surgery or home the next day, and depending upon the degree of surgery performed, you're either in a surgical shoe for 6 to 8 weeks, or you may be in more of a can boot walker, possibly non-weight bearing for a short period of time after a more extensive type of procedure. But after everything is healed, we'll get you into a good arch support, orthotic, custom orthotic, to try to control the mechanics and structural abnormalities that cause the bunion in the first place, because you don't want to have to go through surgery a second time. In fact, you'd rather not go through it at all. Another problem similar to the bunions, in that it's caused by mechanical and structural abnormalities of the foot, would be a hammertoe deformity, so where that toe is bent. And again, different methods of treating that conservatively, change in shoe gear, arch supports. We use different types of pads. Sometimes people develop a painful corn, which is a skin lesion over that. We can shave that down. Sometimes they actually develop an open wound under that can become infected. We use various types of pads, little aperture pads over that, gel sleeves. We have different types of sling products that may straighten the toe if it's still flexible. Sometimes you develop what's called arthrosis, similar to arthritis, but without the pain, where the joint becomes very stiff. And in that case, none of those types of straps will pull the toe down. So what we do is remove a little piece of the head of the bone there, and then we straighten that hammer toe out. In severe cases, we see it's bent here and then bent backward, attaches into the foot. We may have to actually put a pin through there temporarily to hold everything in position. Again, that can be performed as an outpatient in the hospital, or sometimes a more simple hammer toe procedures without the pins can even be performed in our office under a straight local, so you don't have to go to the hospital and be put to sleep. You're in a surgical shoe, generally about 4 to 6 weeks, and these heal very nicely and take care of that deformity. So if you have any type of bunions or hammer toes, or you know someone who does, don't be afraid to come in and see us. Many people say, well, I don't want surgery, so I don't need to go to the podiatrist. But if we can do conservative things to prevent them from getting worse, to take away your pain, your corns, your open wounds, your having the difficulty walking, excuse me, then you may never need surgery, or we could at least avoid it for a little while longer.